Good morning, everyone. All right, I'm from the South, home of Louisiana, so when we speak, people speak back, so we'll try that again. Good morning, everyone. Thank you. I know I'm in the right place now. So, I'm Dr. Byron Jasper, as Dr. Haynes just mentioned, so pleasure to be with you and the first speaker of the morning. I don't know who did that, but I guess they were like, you know what, we need someone who may be a little laid back to get the thing started. So I'm your guy. So as you can tell, I'm going to be talking about basically building a DPC practice in your own vision, which may sound really different, but it actually is a good thing when you're doing it the way you feel you should. So we'll go ahead and get started. Little pop quiz. So we'll take 5 seconds to think about it, and then we'll call out the answer together. So we're going to name this movie that this quote comes from. A lot of people know this movie, and once you see it, I want you to take a couple seconds, and then I want you to call it out. So I'm going to count down for you. We're going to go 5, 4, 3, 2, 1. Field of Dreams. So thank you all for that. I appreciate it. Really complex, but a lot of people don't realize that that is not from Field of Dreams. Surprise, right? Well, if you watch Field of Dreams, the actual quote is, if you build it, he will come. He will come. So Field of Dreams, which came out in about 1989, really good movie, really popular movie. If you haven't seen it, go take a look. But I like to think of the sentence, if you build it, they will come, is actually from a movie called Field of My Dreams. Because that's what I say to myself all the time, and my dream actually started about 2020. So this is my dream, so let me take you into it. We are Byja Clinic, which stands for Beyond Just Another Clinic. And the inside scoop is, hey, when I'm starting my practice, I need a name. Not sure what to call it, but what I do know is I want it to be something easy to say. Want it to be one word, pretty easy for people to remember. So I did the coolest thing ever and thought, hey, let me take the first 2 letters of my first name and the first 2 letters of my last name and just put them together. Hence you have Byja Clinic, Byron Jasper, Byja Clinic. And then we came up with the idea that we're beyond just another clinic, so we actually had to play on words, and ever since then we've been going strong. As mentioned, we are Louisiana's first Black-owned direct primary care practice, and I'm proud to say, thank you. Yep. And I'm proud to say that since we opened, we now have 5 Black-owned direct primary care practices, so happy about that. And the thing about me is that if you know me, I'm not going to do anything kind of half-step or trying to do things kind of sort of. So when I started Byja Clinic, I said, you know what, we're going to have to make it something that looks like what I want it to look like. So this is from flashback of September 15, 2020. This is the video that I put out. If you follow us on social media, you go to our Facebook page and our Instagram page, you can scroll all the way back. You'll see the video of me announcing that we're starting this practice. And the most amazing thing about it was that we had 0 patients. 0. That number right before 1, okay? 0 patients. But you would have never known that because most people who liked the video, shared the video, said, you know what, we're ready for this. Congratulations, we're ready for you to get started. But the other thing people forget is that we started in September of 2020 and there was something going on called a pandemic. So I want you to think about a doctor who's at a faculty program with 0 patients saying, I'm going to start a new model in an area where there are no black doctors, and we're going to do it with no patients and basically no blueprint other than watching a lot of other people on social media. So you got to be really bold, some people say. I like to call it a little crazy, and that's okay, because you may feel crazy doing something that everybody else isn't doing, but eventually they look at you and say, I wish I had the courage you had to do it the way you did. So when we got started, I said to myself, hey, if you build it, they'll come. And in 2020, that's what we started doing. So I said when we're going to get started, we're going to do it this way. We're going to focus on taking care of the underserved. We're going to focus on taking care of those that are disenfranchised by the medical system. We're going to actually focus on something that I have a fellowship in, HIV and Hep C. So I actually made a point to say we're going to take care of a lot of HIV patients. And we're also going to take care of a lot of patients who have Medicaid. Because all of my training, I've worked at FQHCs. I still work at FQHCs. I'm the medical director for healthcare for the homeless in the city of New Orleans. So we literally have affinity for taking care of these really sick and vulnerable patients. So to do that, I said when I started my practice, we're going to keep doing that in the direct primary care model. And some of the numbers that back up what we're doing, this is as of September of 2023. We have about 23% uninsured, about 13% Medicaid. People living with HIV, we're at about 9%, and we actually do PrEP, so pre-exposure prophylaxis, and that's about 3%. And again, that's something that we're continuously doing and continuously growing. So how do we continue to build this in our own way? And my hope is that when you hear this talk, you'll start to do it in your own way when you're looking to get your practice started. Or if you already have started, you start to put your own spin on it and don't feel like you have to do what everybody else does. So this is our practice. I'm the physician on the group. We have Dr. Royce Butler. He's a clinical psychologist. He helps us with a lot of our mental health patients and a lot of the really complex care for those that are basically mentally ill. We have an operations manager, LaToya, and we have a medical assistant, Farah, who just joined us about a month ago. And this is the team of Byja Clinic. And again, we're still growing, and we're hoping to add more physicians and more social workers and things of that nature, and we'll talk about that in a second. These are some of the things that we've done, and I show this because, again, we all can take care of patients. Most of us in the room who are clinically trained can do that in our sleep. But you need to do it in the way that makes you happy. So when you get up in the morning and you're going to the office, you say, I can't wait to get to the office. Not, well, I'm going to the office because I have this practice, and it's cool and all, but you know what? It's not really fun anymore. We always want it to be fun. So the much better looking Dr. Jasper is on the right of the screen. We had a sneaker ball, and we sponsored the sneaker ball, and we got to wear really cool sneakers. Our colors are black and gold, my fraternity colors, and home team for the Saints. So can't strike out when you do that. And again, we sponsored the sneaker ball, and we got a lot of people who learned about us from wearing really cool sneakers because I'm a sneaker guy. On top of that, we do a lot of community outreach. That's myself and LaToya. We had the Black Business Owners Expo, so we actually put a table up there and had a lot of community advocacy people come to us and say, we really like what you're doing. We never knew this was a model. We really want to learn more about you. So us doing it our own way. And this is another thing that I like to tell people. When you come to our clinic, it doesn't look like a clinic. These are some of the art pieces that I put on the wall. I really love canvas art. So canvas art, we have pictures of all kinds of things and other talents that I have. So we had, I believe, a doctor from Texas said, a lot of doctors have hidden talents. Well, one of my talents apparently is when I was in med school, I actually learned how to DJ. So I actually have 2 turntables and a mixer in my house, and I actually do that. That's my therapy. So whenever I'm really stressed out, I just start spinning records. So I literally put album covers on my wall. So these are some of the album covers we have. These are a pair of Jordan 1s, and if you don't know who Michael Jordan is, you can leave now. And then on the other picture, that's a picture of Marvin Gaye and Ray Charles. This is one of our office spaces that we use for some of our tenants. And the idea is we want to make it fun. We want you to come in the office and feel relaxed. We want you to come in the office and want to be there. And guess what? These are actually really good conversation starters. A lot of people come in and say, I remember that album. I remember those shoes. I remember those people. And who are these people? Well, if you know anything about music, from the left is Bob Marley. The middle is David Bowie. To the right is Jimi Hendrix. So imagine when you walk in and you see these pieces of art staring you in the face, it's hard not to have a conversation about it. And patients start to feel a lot more relaxed when they're coming in for their rectal exam, and we're talking about David Bowie. So the goal for us is to make it so relaxing, so fun, that when they come in, they never want to leave. That's why we go beyond just another clinic. That's why we put our stamp on it. And that's why we want you to do the same when you start building your DPC. So these are some of the other things that we do. So, quick story. The picture on the left is me in our first space. Our first space was 500 square feet, all one room. My desk, my exam table, my shelves, my cabinets, everything was one room. And the only thing that wasn't in the room was a bathroom. Why? Because the bathroom is in the back of the office, and I would have to stop my visits and ask patients, would it be okay if my other patient goes to the bathroom? And my patients were so nice, they were like, absolutely. So we would pause our visit, and one patient would walk through to go to the bathroom, and then they would walk back through to go to the bathroom. And I said, well, if this is working, there's nowhere to go but up. So the idea in this space, I always loved that picture because it was literally where we started. And since then, we've started the Byja MC company, where we focus on medical cannabis and getting people access to that. So if a person has chronic anxiety or PTSD and they don't want to take controlled substances, we try to offer them something else. So we give them access and try to be available to them in a non-biased, non-judgmental way. We also recently started the Byja Charitable Alliance, which is going to be really cool. It's a nonprofit arm of our clinic where we're going to focus on doing 340B reimbursement on HIV and Hep C medications, and that 340B reimbursement will allow us to then employ FTEs, a social worker, case manager, dentist, and all of that comes off of those prescriptions from the nonprofit arm. And if we're lucky, which my plan is to do, is to actually pay the DPC doctors to take patients, so we're creating our own ecosystem. So we don't have to rely on outside funding to take care of our patients. We do it ourselves. And that Byja way is that we're doing it differently. We're doing it in our way, and you don't have to do it with the idea of the only way to do 340B stuff is related to a big hospital system or being in an FQHC. We're doing it in a DPC way. So with that being said, a few more things that I'd like to actually highlight. This is our 3-year anniversary. So 3 years happened last Friday. A week ago, we turned 3. Thank you. So when we turned 3, as we turned 3 years old, we said we're going to do something just to celebrate. And if you know my wife, which I encourage all of you to say hello to her because she's amazing, but my wife was like, so are you just going to do your usual red cup celebration? And I said, I don't think anything's wrong with that. And she said, absolutely not. So then she took over and made this amazing setup where all of our patients, our supporters, our family, our friends actually came to celebrate our 3-year anniversary with us. It wasn't just a group of funders or donors or CEOs. It was literally the community. And they showed up and they literally enjoyed every moment of it. Some of that had to do with us. I'm sure the other part had to do with the open bar. But at the end of the day, they also had fun. So the goal for us is to make it to where you and anyone else who comes to our clinic leaves knowing that, number one, we're amazing. We're beyond just another clinic or Byja clinic, but we also want you to know that you can do the same thing in your own hometown, your own community. If you want to take care of HIV patients, do that. You want to do joint injections, do that. You want to do aesthetics, do that. You don't have to do it just because Dr. Jasper did it. Do it because it's for you. And if you build a place that you love to go to and people love to come to, what's the problem? The problem that a lot of people have is that they feel like they have to do it like everyone else. Like you have to go to so-and-so's practice and look at what they did and mimic them. You don't have to do that. Because every time when I walk in my door, I know I'm my own boss. And being my own boss, I love that actual idea of doing it my own way. So the last thing I'll always say with you is if you build it, they will come. And my hope is that you just build it in your own unique way. And maybe, just maybe, it'll be established starting in 2023. Thank you all.
So something I've commonly heard when telling people about direct primary care is, well, that sounds nice for your community. Mm-hmm. It wouldn't work here. Mm-hmm. Can you tell me a little bit about how you had the confidence to know that it would work for your community and specifically to serve the underserved populations that we are often told are going to be left out by a direct primary care movement?
Yeah, I think the common thought is that it wouldn't work for people because they're not invested in it. Right? If you're really invested in a community and you're really invested in making something happen, you'll find a way. Or where there's a will, there's a way. And I have a lot of patients that literally have come to me and say, well, we really want to come, but. So my goal is to take that but and turn it into how, right? And that how is not difficult because I went to medical school and it sounds maybe a little bit of bravado to it, but that was hard. And if that is hard to me and someone's just having trouble getting transportation to my practice, I don't think that's that difficult. So you have that spirit, you have that passion, you'll make it happen. And a lot of people don't feel that way about certain things. And I'll be honest with you, I don't really have a passion of aesthetics. That's just not me. I don't really get excited to hear someone say, I really need Botox. That's just not me. So it's not anything wrong with that. But if a person calls me and say, I really need access to that, I'm not going to be like, well, let me get there at 6 in the morning and figure out your Botox problem. So for me, when I hear that about an HIV patient or a Hep C patient or a Medicaid patient or a patient who's homeless, that's where I get motivated and I feel like it can be done. And DPC lets you do that because you really can do it your own way. And if you can do it your way, I feel like you start to put your own stamp on it and you get a little more excited when you figure out the problem that no one else could. Right? So hopefully that answers your question. Yeah.
Hey, so could you explain, is this membership based? Are they paying an amount every month? And if the people who can't afford that, how are you subsidizing that?
Yeah, so 100% DPC, no hybrid. We have a membership model. Our prices are on our website, transparent like everybody else. And the idea is if we have patients who may not be able to afford it, we do the scholarship, if you will, where we'll end up giving certain people free care because we understand some people can't afford it. And then if not, we have a very much discounted rate for a lot of patients. And we do it on a case-by-case basis. And if we're able to get the nonprofit started, I think all that's going to go out the window because then we're basically going to cover their memberships for them. And if we're doing that for them, there is no obstacle of we can't get you in because it's too expensive. So we want to make it accessible. And that's why I said a lot of people have the idea that, well, you have to set a price based on whatever. And I disagree. I feel like you set a price based on what you feel comfortable, so you feel like your worth is there. And if your worth is there and they're paying you your value, you like taking care of patients a lot more. But then if there's still a barrier, then let's find another way to remove that barrier. It doesn't have to be that in order to give people access, you just have to drop your pricing. I just think that's a different mindset. So for us, we just found a better and a creative way to get people access without us having to undersell ourselves.
First off, congratulations on 3 years
Thank you.
and good presentation.
Thank you.
What was your strategy for marketing and getting such great traction within the 3 years?
Yeah, so if you're a DPC practice or a person looking into DPC, I always love when people reach out to me. I literally was sitting in the crowd yesterday and I had a person reach out to me from undergrad saying they're starting in Atlanta and they're looking for references. So I literally slammed them with all the books that I love to give to people because I think the more we can share, the more we can grow and everybody can win. So one of the books that I think is a really good book is called The One-Page Marketing Plan, and that book is amazing. We do social media posting, we do a newsletter, and then we also do a lot of community events. And by us doing a lot of community events, the hope is that we're out in the community with those vulnerable populations. And the next thing we're doing is a radio show. And my wife literally fusses at me all the time about when are you going to sit down? And the answer is never, but she's going to actually help me do it as well, which always helps us in terms of having good creative energy in the room.
I'll just add my congratulations, and I was interested to hear about your path out of medical education, wondering if bringing learners along is part of a plan or something you're doing now.
Yeah, so we actually, I started doing teaching as one of my fellowships. I did a fellowship at Georgetown that was public health focused, and I was junior faculty at Georgetown. So I've been teaching ever since. And we actually started a nonprofit out of that fellowship called Comprehensive Medical Mentoring Program, where we're focused on getting more minorities into the medical field. So I'm the national president, and we're across the country working on that. So we don't have to teach within the academic setting per se. We build our own stuff. And it's something that I really encourage people to say, if they don't want to give you a seat at the table, just build your own table. And I constantly do that because for me, if it doesn't work, instead of me squeezing myself into the box to make them comfortable, I'm going to be over here outside the box coloring and having fun and tell them my box is way better than yours and it's a lot bigger. So hopefully that makes sense. Yeah.
Can you go through a little bit more about the nonprofit formation and kind of talk to everyone about how you'll pursue funding for that? I think it's a unique way, like you touched on before, on not underselling yourself,
Yep.
but also reaching that population.
Yeah.
We did that. We did that as well at our coaching company, nonprofit, to pursue the underserved populations.
Yep.
So I think it's
Yep.
a really neat way for some people here to extend into the community.
Yeah, so the first thing is if you're looking to go the nonprofit route, feel free to reach out. Love to talk to you about it because it is a long process. It's not something that's quick. We've been working on this for almost 2 years, and a lot of meetings, a lot of legal stuff, and a lot of red tape. But the goal is, of course, if you want to make it there, you can. So but after building the nonprofit, which you got to have a board, you got to have a mission, you got to have the federal government agree that your mission makes sense. It can be something where you're getting funding through donations, and when those donations come in, that can be used to cover the cost of an actual membership, cover the cost of a person being employed. So it's very complex, but once you get into it, it gets a lot easier. It's no different than anything else. And I'll put it like this, if you can put in a chest tube, I'm pretty sure you can pick a nonprofit because one is a little bit more little more tense in my mind. So I think it's something that can be done. It just takes a little bit of planning and just a lot of patience. Yeah. So I think that, oh, one more, yeah.
So I came from an FQHC before I came into direct primary care, and I've got a desire to be able to serve a Medicaid population, but our attorney tells us there's some regulatory challenges that go along with that, and we have not figured out how to implement that.
Yeah.
Would you help us figure out how to do that, and if there's others that might be able to tap into and be able to serve that population?
Yeah, would love to. Again, I think that population gets missed in the model because a lot of people see that roadblock, that red tape, and they get really like frustrated to where they don't want to necessarily keep going down that road. But I work at FQHC still, and I know that the population needs really good care from people like us. So when you have someone who's really wanting to figure it out, let's do it. I'm all for it. Hopefully that is a good answer. So, anything else?
Awesome.
Yep.
Awesome. Thank you.